1 year ago this week, President Barack Obama signed into law health care reform. Historic. It's the Patient Protection and Affordable Care Act. The question is, though, 1 year later, how has this impacted us so far, and what does the future hold? Joining us this morning to answer that question and many more from Hollis Companies are its Executive Vice President, Sharon Hanahan, and its President and CEO, Mike Hollis. Sharon, Mike, thank you guys so much for coming in this morning.
Thank you.
Well, you know, 1 year later, still an extremely divisive issue, especially depending on what side of the aisle you fall on. But there are some positives and there are some negatives. Let's talk about those.
Yeah, and Jocelyn, you know, there's been so much that's happened in the past year, whether it's with your own family or, of course, with the national media, and this focus really on what's going on over in Libya or, you know, or even the horrors in Japan. This anniversary has kind of slipped on by. It's been 1 year, and there's already lots of different aspects of this law that are in place. One thing we know that hasn't changed is public opinion.
Right.
The LA Times reported just a few days ago that it's still about a little bit more against it than for it. We also know, and the biggest challenge that we have, and the reason that we wanted to talk today, is most people are unaware of the changes. And there are several, like I said, several changes that are already in place today that folks need to know about.
And a lot of this still going into effect in the future. But, you know, you hear from the Obama administration, well, the further we get into this, public opinion will change, but it hasn't 1 year in.
It hasn't, and the fear is some of these things that we're going to talk about today are pretty nice things that I think a lot of people agree on with both sides of the aisle on change was needed. Unfortunately, some of the costlier things and the cost, the price tag for these things that we can get access to today are going to cost us in the future, and that is a big challenge.
That is a challenge. Well, Sharon, let's talk about some of these positive aspects. What do people need to know about this health care reform that's already in effect?
Sure. What went into effect in 2011 for plan years? Removing of lifetime maximums. Many insurance contracts had maximums of 1 million, 2 million, 5 million, so those are gone. The expansion of coverage for dependents actually was instituted early by many insurance carriers. You can cover your children up to age 26 now. Pre-existing conditions are waived now for children up to age 19. Of course, a lot of questions we get, oh, now when is it going away for adults? That doesn't happen until 2014, which is really a big year. But we also have, for non-grandfathered plans, and if you like, we can do a little explanation for that, preventive care covered at 100%. Who can argue that covering colonoscopies, mammograms, incenting people by waiving all cost-sharing deductibles and copays to go, you know, have the preventive screenings done. So there are some good things going on, but like Mike was mentioning, some very onerous things coming in the future in the way of taxes and fees and things to pay for the expansion of coverage.
One other benefit that has come out, and hopefully folks are taking advantage of this. You know, in our region, we don't have that many large employers, but we've got tons of small businesses.
Right.
And one of the benefits that were put in place is a small business tax credit for those employers that have 25 or less employees. There's a reduction or a tax credit based on the number of employees. Now, there's certain rules that go along. You have to pay 50% of the health care premium to the employee for the employee's health premium, but you get a tax credit. That started in 2010. So, you know, right now we're doing our taxes for 2010.
Right.
And small businesses, talk to your CPAs if you haven't already, and make sure that you're taking advantage of this. This is going away, kind of ironically. This is in place for just a few years, and then it phases out. So, unfortunately, for small businesses, take advantage of it now, because in a few years, when some of these other costlier things come in place, this is going away. So, save that money if you get any tax credits right now.
I want to talk a little bit about the future of healthcare in just a moment. But first, if someone's watching this morning, a lot of folks are probably wondering, I didn't know that. I didn't know this was in effect. How can they find more information on this?
You know, most folks access their care through their employer, and their employers and then the insurance companies are also doing a decent job. I'd say decent communicating the changes. The contracts are automatically being updated as per federal law. So when they come upon their renewal, a lot of folks probably renewed January 1, and they saw lots of these changes impact in. But they're kind of hidden. And you know, in the insurance business, I think we sometimes, I say we, but we always kind of lump everything together and it kind of gets buried. And so that's really the purpose for us to kind of spell out these few things that are important for folks to know, these big changes.
Okay, okay, we just have under a minute, and how can you talk about the future of healthcare in under a minute? But the controversial things coming up, let's talk a little bit about those.
Sure. Taxes. There's going to be taxes to pay for the expansion of care.
Right.
Fees, millions of dollars of fees paid by insurance companies. Penalties if you do not buy. That's the most controversial part, is the individual mandate. Lawsuits have already started, and they're all split decisions, if you've noticed, depending on where you are, what judge is listening. It will go to the Supreme Court, there's no doubt about it, and there's going to be two issues. One is the individual mandate, but there's another provision, severability, is if you take out the individual mandate, if you deem that unconstitutional, does that make the whole bill unconstitutional? So they will be actually looking at both of those issues.
Wow.
So
there's lots of uncertainty about the future.
Right.
You know, whether this bill is even going to make it all the way through, we don't know. The federal, the Florida declaring it unconstitutional, it's going to make its way to the Supreme Court. We know that at some point. The challenge is as Sharon said, is the cost, the burden on the small businesses and on each of us as consumers. We're going to all be forced to buy health insurance.
Yep. Yeah, really interesting. We'll have to wait and see what happens. But right now, yes, we can focus on the changes already in effect. We'd love to have you guys back on as this heats up, as we move toward 2014. So thank you guys so much for coming. We appreciate it.
Thank you, Jocelyn.